non-typical, non-tubercular, M. kansasii Fournier gangrene. Mycobacterium kansasii, or M. kansasii, is a non-tuberculous mycobacterium, which most commonly causes chronic upper lobe cavitary lung disease, similar to Mycobacterium tuberculosis. Disseminated disease is rare and usually occurs in the setting of immunocompromise. In addition to pulmonary involvement, M. kansasii infection has been reported in numerous other sites. It has not been reported, however, as the causative organism in necrotizing fasciitis of the perineum, known as Fournier gangrene. The case presented here involves a 55-year-old man with a history of kidney transplant and inflammatory arthritis on tacrolimus and high-dose prednisone who presented to the emergency department with pain, swelling, and erythema of the perineum and scrotum. A small red papule had progressively worsened over the past year until severe pain of the perineum and scrotum prompted him to seek medical attention. His presentation was further delayed, however, despite guidance from his physician, due to concerns surrounding the novel coronavirus pandemic. On presentation, the patient was afebrile, tachycardic, and hypertensive. Physical exam was notable for perineal erythema and fluctuance, with diffuse tenderness to palpation that extended to the scrotum. There was also lumbar paraspinal tenderness, and solitary cutaneous nodules were noted on the patient's scalp and thigh. The patient's ED course included a scrotal ultrasound, which was suggestive of underlying infection, and incision and drainage of the perineal abscess, which produced copious purulent fluid. Broad spectrum antibiotics were initiated, and the patient was admitted to the medicine service. On hospital day 3, surgical exploration of the perineum and scrotum showed necrotizing infection, and operative cultures eventually grew M. kansasii. Interestingly, review of the patient's past microbiology data indicated that a sputum culture the year prior had been positive for the very same organism. On hospital day 6, the cutaneous nodule on the patient's thigh, pictured in the image labeled 1, was biopsied, and culture of this tissue was also positive for M. kansasii, raising suspicion for disseminated infection and prompting further workup. Chest CT then demonstrated a 1.9 centimeter pulmonary nodule, as seen in image 2, and MRI of the lumbar spine demonstrated L3-L4 and L4-L5 discitis and osteomyelitis, as seen in image 4. The pulmonary nodule decreased in size on serial imaging, so biopsy was not pursued. Vertebral biopsy, however, was positive for, you guessed it, M. kansasii. The patient was treated with antimycobacterial therapy consisting of azithromycin, rifampin, and ethambutol, and underwent serial debridements of the perineum. Gradual improvement of the patient's Fournier gangrene is evident when comparing images 3 and 5, which show the perineum after the 11th and 20th surgical debridements, respectively. To our knowledge, this is the first reported case of Fournier gangrene due to Mycobacterium kansasii. Disseminated M. kansasii is rare and has a variable presentation, but it is most seen in immunocompromised patients like ours. Infection typically begins in the lung, but reports of extrapulmonary disease in the literature include lymph nodes, skin, and the musculoskeletal system. Taken all together, our patient likely had M. kansasii lung involvement to begin with, and then increasing doses of immune-suppressing medications made him susceptible to dissemination to some expected sites and an unexpected one, the perineum, indeed making this a case of non-typical, non-tubercular Mycobacterium infection. Several lessons can be taken away from this case. First, a high index of suspicion is needed to identify uncommon infections like disseminated M. kansasii in immunocompromised patients, as non-specific presentations may delay diagnosis. And second, the COVID-19 pandemic has caused non-pandemic related harms. The perceived exposure risk of healthcare settings has created a barrier to care and has resulted in neglected health conditions, the consequences of which the healthcare system will continue to face in the coming months. Thank you.